My name is Inhye Ahn at Dana-Farber Cancer Institute. I'm a CLL specialist. The study that we presented at the EHA meeting this year is a phase 2 study combining Pirtobrutinib and Obinutuzumab in previously untreated CLL patients. While both of these drugs have been approved respectively for the treatment of CLL, it hasn't been tried to give it as a fixed duration therapy. So this combination as a fixed duration therapy was one of the novel approach. The other approach that is innovative for this study is that we conducted a very detailed cardiac testing on some of our patients who participated in this study. So what the study had been doing was to give patients 6 cycles of Pirtobrutinib, which is a pill drug taken for approximately 6 months. And then we added an IV drug called Obinutuzumab on top of Pirtobrutinib and gave that combination for additional 6 months. So total 12 cycles of therapy, which is less than about a year. And everyone stopped therapy no matter what their clinical responses or the depth of responses were. What we have found was that response rate was generally high. The regimen was very well tolerated, with 88% going up to the 12 cycles of therapy at the time of data analysis, and some of them still ongoing in terms of study therapy. The study adverse event profile was also very favorable. High-grade infection was found in 5% of the patients, which was very low in terms of CLL research. In terms of the cardiac finding, which is an important study finding, we did echocardiogram, cardiac MRI, telemetry, and whole blood pressure monitoring before and after 6 cycles of Pirtobrutinib monotherapy, and found that really doesn't affect the heart function, rhythm, or the blood pressure that much. We saw very minimal increase in blood pressure by 5 millimeter mercury or less. There were no structural or functional changes to the heart, which is a great finding. One patient did develop a heart rhythm abnormality called atrial fibrillation, but this patient did have a remote history of atrial fibrillation in the past, so it could be correlated to that past medical history. So overall, well-tolerated regimen, fixed duration therapy, which is exciting, and very favorable cardiac safety findings.